Are you having suicidal thoughts or know someone who is? Simply put, suicidal ideation means thinking about wanting to end your own life. But there are two types, passive and active. Passive suicidal ideation is when you wish you were dead but don't plan to do anything about it. Active suicidal ideation goes a step further. It's not just thinking about it. It involves wanting to die and making plans on how to do it. It's important to address the issue of suicide across all age groups. According to the CDC, in 2021, at least 20% of high school students seriously considered attempting suicide. Suicidal thoughts can be a symptom of major depression or bipolar disorder, but they can also happen in people with other mental health issues or even those without any mental illness. How common is suicidal ideation? The chances of people worldwide having thoughts of suicide at some point in their lives are around 9%, and within a year, it's about 2%. According to a 2017 survey in the United States, about 4.3% of adults aged 18 and older had thoughts of suicide. This was more common among adults aged 18 to 25. For individuals with mental health disorders like major depression or bipolar disorder, the likelihood of having suicidal thoughts is much higher, though the exact numbers aren't clear. Sadly, suicide rates are increasing. In the United States, more than half of the states have seen over a 30% rise since 1999, and nearly all other states have reported increased rates, according to the Centers for Disease Control and Prevention. Suicide is the 10th leading cause of death in the United States, and the second leading cause among 10 to 34-year-olds. Although women attempt suicide more often, men are more successful, with 3 to 4 times higher rates of completing suicide than women. What are the signs and symptoms of suicidal ideation? It's crucial to be aware of warning signs that someone, including yourself, might be thinking about suicide. These signs include 1. Isolation, withdrawing from friends and family. 2. Hopelessness, feeling a sense of despair or feeling trapped. 3. Talk of death or suicide, expressing thoughts about dying or ending their life. 4. Giving away possessions, disposing of belongings as if saying goodbye. 5. Increased substance use, using drugs or alcohol more than usual. 6. Mood swings, experiencing heightened anger, rage, or irritability. 7. Risk-taking behavior, engaging in dangerous activities like drug use. 8. Access to means, having access to items that could be used for self-harm, such as medications, drugs, or firearms. 9. Saying goodbye, behaving as if they are saying farewell to people. 10. Extreme anxiety, feeling intensely worried or fearful. If you suspect that a loved one might be thinking about or planning suicide, don't hesitate to ask them directly. Contrary to a common myth, asking about it won't give them the idea, but it shows that you care and are concerned about their well-being. It's essential to recognize that passive, suicidal thoughts like wishing for an accidental death can be just as serious as actively planning suicide. These thoughts can shift from passive to active and often involve a mix of both. Keep in mind that suicidal thoughts can vary. They might be intense and persistent one day and less specific or frequent the next. It's crucial to take these thoughts seriously, even if there seems to be improvement. If your loved one admits to thinking about suicide, prioritize their safety. Offer your support, and if the situation is severe, involve their doctor or mental health professional. You can also reach out to a suicide hotline for guidance. Stay connected with them until you're confident that they're in a safer mental state. Your caring presence and assistance can make a significant difference. What causes suicidal ideation? Suicidal thoughts can stem from various factors, especially when you're feeling hopeless or overwhelmed. These feelings often arise when life seems out of control or lacks meaning. Several situations can trigger these thoughts, including relationship issues, traumatic events, substance abuse, crises, work pressure, health problems, or financial struggles. Additionally, having a mental health condition like depression, bipolar disorder, PTSD, or anxiety can also play a significant role in suicidal ideation. Several risk factors can contribute to suicidal thoughts and the risk of suicide, such as 1. Past suicide attempts. Having attempted suicide in the past. 2. Mental health disorders. Presence of mental health conditions. 3. Feelings of hopelessness, isolation, or loneliness. Experiencing a sense of despair or being socially disconnected. 4. Marital status, not being married. 5. Military service, having served in the military. 6. Chronic physical illness, dealing with conditions like cancer, diabetes, or terminal diseases. 7. Chronic pain, experiencing long-term pain. 8. Traumatic brain injury, having suffered a traumatic brain injury. 9. Family history of suicide, having relatives who have died by suicide. 10. Substance use disorders, struggling with drug or alcohol abuse. 11. Childhood abuse or trauma, having experienced abuse or trauma during childhood. 12. Rural living, residing in a rural area. 13. Access to firearms, having easy access to firearms. How to diagnose suicidal ideation. If you're dealing with depression and having thoughts of suicide, your doctor may conduct a medical exam and ask you questions through a questionnaire. Some of these questions might include 1. History of depression or mental illness. Have you experienced depression or mental health issues in the past? 2. Duration of suicidal thoughts. How long have you been having thoughts of suicide? 3. Suicide plan. Have you made a plan for how you would carry out suicide? 4. Medication. Use. Are you currently taking any medications, and if so, what kind? 5. Substance use. How often do you use alcohol or drugs? Additionally, you might encounter a suicidal ideation scale, which is an assessment tool designed by health professionals to evaluate the risk of suicide. These questionnaires often explore how individuals perceive themselves, whether they feel helpless, and if they have a negative outlook on life. These assessments help healthcare providers understand the severity of the situation and determine the most appropriate course of action for support and treatment. Here are examples of suicidal ideation scales used to assess the risk of suicide. 1. Ask suicide screening questions. Consists of 4 questions for both children and adults, aimed at detecting early signs of suicide. It's quick, taking only 20 seconds to administer. 2. Beck Scale for Suicide Ideation. Comprises 19 questions designed for adults. Administering this scale typically takes 5 to 10 minutes. 3. Columbia Suicide Severity Rating Scale. A concise questionnaire that doesn't require formal mental health care training for administration. 4. Suicide Probability Scale. Assesses well-being and coping behavior using a 4-point scale. It generally takes 5 to 10 minutes to complete. What are the treatment options for suicidal ideation? If you're having suicidal thoughts without an immediate crisis, your doctor or therapist might recommend various approaches to help reduce the risk of suicide. These can include 1. Psychotherapy. Working with a therapist to explore the reasons behind your suicidal thoughts and developing coping strategies. 2. Family therapy and education. Involving your loved ones in treatment to enhance their understanding, recognize warning signs, and improve family dynamics. 3. Substance use disorder. Treatment. Addressing any increase in alcohol or drug use if relevant to your situation. 4. Lifestyle changes. Making adjustments to manage stress, improve sleep, adopt healthier eating and exercise habits, building a strong support network, and allocating time for hobbies and interests. 5. Medications. If your suicidal thoughts are linked to underlying depression, medications such as antidepressants, antipsychotic medications, or anti-anxiety medications may be prescribed. An important warning before we move on. If you experience suicidal thoughts after taking antidepressants, contact your mental health care professional immediately, as these antidepressants have been associated with an increased risk of suicidal thoughts. How to cope? Here are some ways to help reduce suicidal thoughts and seek the necessary support, whether for yourself or a loved one experiencing suicidal ideation. 1. Identify triggers. Recognize triggers or situations that contribute to feelings of despair, such as a loss, alcohol use, or relationship stress. Eliminate what you can and talk to a counselor or a close friend about the remaining challenges. 2. Remember, feelings are temporary. Understand that feelings come and go and are not permanent. Seek treatment to learn coping strategies and gain a new perspective on life stresses. 3. Take breaks and rest. Acknowledge that sometimes taking a nap or getting a good night's sleep can reset your mood even in moments of deep distress. 4. Self-care. Ensure you're eating healthy meals regularly and avoiding skipping meals. Prioritize rest and relaxation to alleviate stress and allow your body to recover. Engage in regular exercise to relieve stress and enhance emotional well-being. 5. Build a community of support. Spend time with people who have positive influences on your life and make you feel valued. Contribute to your community through either time or financial support. Helping others can provide a sense of purpose and distract from personal challenges. 6. Get active. Develop personal and professional interests that bring you joy. Engage in fun activities, volunteer work, or meaningful projects to foster a sense of purpose. By pursuing fulfilling activities, you enhance your self-esteem and reduce the likelihood of despair returning. 7. Relax. Find personalized ways to manage stress levels. Practice relaxation techniques such as meditation, sensory strategies, and simple breathing exercises. Challenge and overcome self-defeating thoughts, creating a healthier mindset. Keep the following in mind. Though it may be difficult, studies show that if you're able to talk to someone regularly, particularly in a face-to-face situation like to a close friend or counselor, you're less likely to attempt suicide. You can also talk to your doctor or go directly to the emergency room if you are having suicidal thoughts. Doctors will evaluate your immediate risk and may recommend hospitalization if the risk is severe or refer you to a mental health professional for treatment. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.